Uh, Good morning, everyone. I am Dr. Sonlen Mang Phaipi. I am a second-year postgraduate in Institute of Child Health. This morning, I'll be discussing the study that we conducted in our hospital, which is a comparative study of fosphenytoin and levetiracetam as second-line anticonvulsants for pediatric status epilepticus. Let's begin with some background. Status epilepticus is a medical emergency which is characterized by prolonged seizure or seizure which do not terminates without recovery between episodes. The first line of treatment is usually benzodiazepines, which is given intravenously. However, when seizure persists despite benzodiazepine use, second-line anticonvulsants are required. Phenytoin or fosphenytoin has traditionally been recommended as second-line anticonvulsants. However, limited comparative research exists on the effectiveness of these drugs. Additionally, concerns over their safety profiles have sparked interest in alternative second-line agents. Therefore, we conducted a randomized control trial to examine the efficacy of newer anti-epileptic drugs. The objective of our study is to assess the efficacy of intravenous levetiracetam and fosphenytoin as second-line anticonvulsant for pediatric status epilepticus. Coming on to our methodology, our method is an open-label randomized control trial, and the age group we took around is 3 months to 16 years of age who presented with status epilepticus, and they are randomly assigned to get levetiracetam or fosphenytoin. And to assess the efficacy is assessed by the cessation of clinical seizures, activity within 5 minutes of infusion cessation, and the recurrence of seizure within 24 hours. Let's now delve into our findings. Our study population mainly consists of 58% females, 58% males, and 42% females. Our study found that levetiracetam and fosphenytoin has comparable efficacy as second-line anticonvulsants for pediatric status epilepticus. Specifically, levetiracetam is terminating status epilepticus in 72%, which is more or less in the same with fosphenytoin. And our secondary outcome, need for further anticonvulsants. Even in levetiracetam, there is a need for around 96%, whereas in 4% there is no further need of any anticonvulsants. Furthermore, we observed that both levetiracetam and fosphenytoin could be initiated promptly with a median time of around 11 minutes for levetiracetam and 12 minutes for fosphenytoin. This suggests that both the drugs can be administered. In a timely manner. And even for levetiracetam and fosphenytoin, the rapid sequence intubation required to terminate the seizure is around 7% in levetiracetam and around 12% in fosphenytoin. And coming on to the serious adverse events that we have, we compared the safety profiles of both levetiracetam and fosphenytoin. Our study revealed no difference between the two drugs. Both levetiracetam and fosphenytoin demonstrated a similar incidence of adverse events, indicating that they are generally well tolerated as second-line anticonvulsants for pediatric status epilepticus. And in our study, we had one case of death which is not related to the medicines or medicines that we have given. And this is the few adverse events that we have faced during our study. And in conclusion, based on our findings, levetiracetam could be considered as a suitable alternative to fosphenytoin as a first choice second line anticonvulsants for pediatric status epilepticus. However, it is important to note here that further research is needed with larger sample size and higher levetiracetam doses to establish its efficacy conclusively. Nevertheless, it is essential to highlight that fosphenytoin and levetiracetam remain reasonable options for second-line treatment of established benzodiazepine refractory status epilepticus in children. And to replicate the efficacy seen in our study, it is crucial to adhere to the consistent dosing according to the guidelines. And these are the references that we refer to. Thank you.
How many cases have been already reported from this related questions? Is there any previous study related to this fosphenytoin and levetiracetam comparison?
Yes, ma'am, there are a few. Yes, ma'am.
So what was the result in their review?
Ma'am, more or less the result that we get over here, it's similar to the results that's present.
Okay. So ultimately, what is your outcome?
Ma'am, the outcome is where levetiracetam can be used as a first choice second line instead of fosphenytoin. Because fosphenytoin can have some serious adverse events also, like hypotension, cardiac arrhythmias, whereas levetiracetam is a bit on the safer side compared to...
But in your study you have shown
Yes, sir.
that the fosphenytoin and levetiracetam
Yes, sir.
both have the same safety profile.
Yes, sir.
So how can you say that fosphenytoin is not good as levetiracetam? Rather, you have emphasized
Yes, sir.
that levetiracetam needs much higher doses.
Much higher doses.
So why not fosphenytoin as a first-line treatment as a second drug? And why do you prefer fosphenytoin over phenytoin? Which one is cheaper?
Sir, fosphenytoin, sir.
Phenytoin cheaper or fosphenytoin cheaper?
Phenytoin, sir.
Then why are you going for fosphenytoin?
Sir, phenytoin has more serious adverse events compared to fosphenytoin.
Okay.
And that's why.
Okay. So why did you did that study? What is the intention of your study? You wanted to establish that levetiracetam may be used much more in the PICU setup.
Yes, sir.
Okay.
And it's more readily available. So that's
Okay. Okay, thank you.
thank you, sir.
So, Minan, please proceed.